Now let's talk about some sinus headaches. Sinus headaches are usually sometimes, to allergies, and they're seasonal. So you want to make sure and work all the sinuses. We have 4 sinuses. We have the frontal sinus, the sphenoidal sinus, the ethmoid sinus, and the maxillary sinus. And out of all 4 of them, the maxillary is the largest. So you want to start doing some like light strokes just all over the face, letting your client know that that you're going to start working the face already. And I like to start actually with a frontal sinus. So you can do some grasping here, lifting. The occipital frontalis actually comes around and it inserts right here, and it's the one that raises your eyebrows. So you want to make sure and work the eyebrows real gentle. Just start lifting and grasping between your finger, and just working, loosening up, especially this frontal sinus. You can do some trigger points. Remember that trigger points, you can hold the trigger point if you find a trigger point anywhere from 10 to 15, 20 seconds. And if it is already just, if it doesn't go away, then come back to it. While you're here, you want to treat the sphenoid. The sphenoid bone is the one that looks like a bat right behind your ear, behind your eyes. And sometimes their eyes hurt, and it's because of, maybe the sphenoid sinus. I like to kind of push back and forth a little bit to loosen up that bone. And remember, the pineal gland is in the sphenoid bone, in the sella turcica of the sphenoid bone. So make sure you work this frontal area here really circular. You can, just glide across, some cross friction. And you can also do some tapping, because this is your frontal sinus. And some people get, if you have a sinus infection, it's come all the way up here, it'll hurt their forehead, by their eyes, it'll hurt. So you want to do some light tapping, and then move to the sphenoidal bone, and then do some circular motions here. Now we're going to move to the maxillary sinuses. And I like to start with some trigger points right along. These are actually the worst. When you treat somebody that has had a sinus headache, these are usually pretty bad. And I find trigger points usually like right halfway through here. So all of these are really tender. You can do one at a time with one finger. I usually start putting my fingers down until I have 3 fingers. I'm right under the zygomatic arch. So I treat this gently, especially if they have had a sinus infection. It's usually right here, right on the maxilla. And the maxillary and the ethmoid and sphenoid and frontal bone are hollow. Those are resonating chambers for your voice. So when you have a cold or you have an infection in your face, your voice changes. You sound different, because then your voice is not able to resonate against those chambers. So it changes your voice, and you sound muffled and you sound funny. So that's when you know when somebody's catching a cold or has an infection. You can do some gliding down the cheeks right here. Just getting some stretches here along on the face. I like to treat right along the chin, above. The masseter muscle inserts around here. Be careful with the parotid gland. The parotid gland is about 1 inch. It's the largest salivary gland, and it's right in front of the earlobe. It's the largest salivary gland. So right here, you don't want to put pressure. You want to ask your client to clench. Can you clench your jaw? Oh, right here. Okay. Okay. Relax. When they clench, you can feel the masseter, which is really your strongest muscle in your body, according to, and for the proportion of its size, it's really strong, because it's for chewing. That's how people survived for years, you know, by chewing hard things like meat. So right here, you want to treat the masseter muscle, especially for TMJ. So when you're going to treat for the TMJ, you want to make sure and treat right here the masseter muscle, and you want to treat the lateral pterygoid. So you're going to ask your client to open up their mouth gently, drop the mandible. Remember, the mandible is the only one that moves. The maxillary bone does not move. It's the mandible that moves and opens up. So when they drop it a little bit, you glide your fingers right where there's like a little indentation. It's like a little dip. It's like right around here. And right in there is where the lateral pterygoid originates. So you want to make sure and just treat that in circular motion for somebody that has TMJ. You're going to work the outside of the face and the inside of the mouth. And TMJ is common for people that have dental work, you know, like if you're getting a root canal and your mouth is open for 3 to 4 hours. I've worked on people that have really bad TMJ because of that. They grind their teeth sometimes, or they clench their jaw at night. So you want to make sure and treat the muscles of mastication for somebody that has TMJ. So these are some of the things that you can do on the face. Now I'm also going to do like some traction here. I'm going to put the palm of my hand at her temporal bone, the other one at the zygomatic arch, and I'm just going to push my hands like toward, this is all I'm doing, like this. Put a little bit of tension there to try to relieve some of those bones. Sometimes it's like putting like traction, and it feels good, and it starts relieving some of those headaches, especially like a migraine headache. And most people don't come in if they have a migraine headache because it's really debilitating. But when they come in afterwards, you can do some of these techniques just to start releasing some of that pressure from their head. And okay, so you've done that. Now another one that I like to do is I hold their forehead. Then I go, this is cartilage, so you go to the nasal bone, which is right here, and then I just try to move it. You know, this is all I'm doing, trying to do just to create a little bit of movement at the nasal bone, especially for people that have sinus headaches. Oh, I felt something. Did you feel that? I felt that her bone moved just a little bit. And I like to do lots of tapping, because especially if they have sinus headaches, you definitely want to do some tapping. And you can do 2-finger tapping. You can do all the fingers, or you can do the 2-finger tapping. The frontal sinus, the sphenoid sinus, sphenoid bone, the maxillary bone, which is the largest sinus, and the whole face tapping.